Good morning. The September 21st, 2022 meeting of the Board of Estimates is now called to order. For the interest of conducting this meeting as appropriate as possible, we ask all of our guests, members of the press, members of the general public, or folks here to present on items to ensure that your cell phones and any electronic devices are on silent. We'll also ask, as a mandate of the city, that if you're not here in front of us at the podium speaking, that you also wear a mask. This board is vaccinated as well as boosted, so when we're speaking, we will also take our mask off. For those at home in this hybrid environment, if you are speaking, please allow the board to call attention to you. At that time, you will unmute your phone and you will be recognized by the board. At this time, I will ask our clerk, Ms. Celeste Amato, for any corrections, additions, or noted abstentions to today's agenda.
Thank you, Mr. President, and good morning, everyone. We have a few things to note this morning. For changes and corrections on page 93 under background explanation, please delete the entire paragraph beside the second bullet on that item. Also this morning, we forwarded 6 addenda to this morning's agenda, otherwise known as walk-on items. Those items are coming from the Mayor's Office of Recovery Programs, and I need to read those into the record this morning, so y'all bear with me as we run through a number of memos this morning. The first item from the submitting agency, again, Mayor's Office of Recovery Programs. The action requested, the Mayor's Office of Recovery Programs requests that the Board of Estimates accept a grant agreement between the Mayor's Office of Recovery Programs and Baltimore Core Incorporated for providing Baltimore's underemployed with sustainable employment. The dollar amount is $371,000. Background explanation: on June 30th, 2022, the Mayor's Office of Recovery Programs awarded funding from the Coronavirus State and Local Fiscal Recovery Fund provided by the American Rescue Plan Act of 2021 in the amount of $371,000 to the Baltimore Core Incorporated to recruit from MOED workforce pools to identify those ready for career advancement, upskill candidates for careers in service by providing career navigation and training for place for purpose positions, and identify placement partners to hire from workforce pools and receive training in equitable living practices. The purpose of the agreement is to provide funding for the following: $45,000 for consultant support to recruit from established workforce pools to target those ready to take a second step in career development, $5,000 for professional learning and development training and supplies for job seekers, $5,000 for career development tools that foster greater career development, access to network and engagement, including career coaching and navigation, $10,000 for software tools for professional and career development, $285,000 for personnel costs for 7 staff members to support program implementation, and $21,000 for administrative expenses. Item number 2 from the Mayor's Office of Recovery Programs was a grant agreement with Free State Justice Incorporated. I'm letting the board know that that item has now been withdrawn. Item number 3 from Mayor's Office of Recovery Programs, the action requested of the board is to accept a grant agreement between the Mayor's Office of Recovery Programs and Baltimore Clubhouse Incorporated for No One Turned Away, providing mental health support in Baltimore. The amount of the grant is $500,000. Background explanation: on June 30th, 2022, the Mayor's Office of Recovery Programs awarded funding from the Coronavirus State and Local Fiscal Recovery Fund provided by the American Rescue Plan Act of 2021 in the amount of $500,000 to the Baltimore Clubhouse Incorporated to help adults living with mental illness fight social isolation by providing recruitment, orientation, and continued engagement for members and supporting member career development. The purpose of the agreement is to provide funding for the following: $463,295 for staffing to provide program implementation, including a membership program coordinator, a culinary program coordinator, and 2 career development coordinators, $12,353 for supplies and equipment, and $24,352 for administrative expenses. Item number 4 this morning is from the Mayor's Office of Recovery Programs. The action requested of the board is acceptance of a grant agreement between the Mayor's Office of Recovery Programs and Baltimore Vicor Colum Incorporated for response to COVID and health needs. The amount of money is $285,000. Background explanation. Again, on June 30th, 2022, the Mayor's Office of Recovery Programs awarded funding from the Coronavirus State and Local Fiscal Recovery Fund provided by the American Rescue Plan Act of 2021 in the amount of $285,000 to the Baltimore Procurement Incorporated to educate and vaccinate Baltimore residents, especially in areas of low vaccination rates, and residents who are homebound. Baltimore Procurement Incorporated will also provide food assistance, financial assistance with medical needs, free medical equipment, and transportation to residents experiencing medical issues. The purpose of the agreement is to provide funding for the following: $176,000 for staffing, including a program director and operations manager, $73,000 for food assistance, $28,000 for financial assistance for medical bills, and $8,000 for technology resources. Item number 5, submitting agency is the Mayor's Office of Recovery Programs, and the action requested of the board is approval of a grant agreement between the Mayor's Office of Recovery Programs and Urban Strategies Incorporated. The amount of money is $2,300,000, and the background explanation is as follows. The Mayor's Office of Recovery Programs has awarded funding on June 30th from the Coronavirus State and Local Fiscal Recovery Fund provided by the American Rescue Plan Act of 2021 in the amount of $2,300,000 to provide support to Baltimore City residents affected by the redevelopment of Perkins Homes by enrolling individuals in case management that will provide opportunities for economic mobility, youth development, education, and health assistance. Specific strategies to address various issues faced by residents during the pandemic will include tutoring, tuition assistance, career exposure programming, and workforce development, as well as support for housing stability, technology to address the digital divide, and assistance for gap healthcare costs. And item number 6, Mayor's Office of Recovery Programs. The action requested of the board is approval of a grant agreement between the Mayor's Office of Recovery Programs and Ministers Conference Empowerment Center, CDC. The amount of the grant is $1,200,000. Background explanation. The Mayor's Office of Recovery Programs has awarded funding on June 30th, 2022 from the Coronavirus State and Local Fiscal Recovery Fund provided by the American Rescue Plan Act of 2021 in the amount of $1,200,000 to provide STEM instruction, enrichment experiences, job shadowing, workforce training, job placement, and opportunities for career advancement in the railway, maritime, and other tech careers. That is the final change and or correction to the agenda for this morning. There have been no protests received this morning on items on today's agenda. And the following items have been moved to the non-routine agenda. On page 42, the Department of Transportation Extra Work Order number 14. On page 43, Department of Transportation Extra Work Order number 15. On page 44, Department of Transportation Transfer of Funds. On page 45, Department of Transportation Transfer of Funds. On page 91, Police Department Agreement. On page 96 through 97, Mayor's Office Third Amendment to Non-Construction Consultant Agreement. On pages 137 through 138, item number 12, Bureau of Procurement, contract number B50003266, police uniforms. On page 144, Bureau of Procurement, solicitation number B50006455, Medicare Advantage Plan with prescription drug benefits. On page 145, Bureau of Procurement, B50006476, pharmacy benefits management. On page 146 through 147, Bureau of Procurement, B50006336, medical administration services for HMO and PPO plans. And additionally, the addenda 1 through 6, aside from the withdrawn item number 2, those items will also be part of the non-routine agenda. And we have the following abstentions this morning. The Honorable Mayor Brandon Scott is abstaining on pages 65 through 66. Health Department, agreement with Johns Hopkins University, School of Medicine, Intensive Primary Care. On page 74, Health Department, agreement with Johns Hopkins University. On page 79, Health Department, provider agreement with Johns Hopkins University. The Honorable President Nick Mosby is abstaining on page 34, Police Department, intergovernmental agreement with the Office of the State's Attorney of Baltimore City. And on page 150, City Council, travel spend authorization. The Honorable Bill Henry is abstaining on page 150, City Council, travel spend authorization, and has asked that the following statement be read into the agenda. Based on the final agenda for the Board of Estimates September 21, 2022 meeting, I have the following abstention to report, page 150. City Council travel spend authorization. I am abstaining from this item because it is an expenditure from a component of an elected official's budget that was approved as part of the annual appropriations process. As I explained publicly when amendments to the administrative manual's travel provisions were enacted in 2021, elected officials are directly accountable to the voters for their use of taxpayer funds. And the comptroller goes on to ask that this statement become part of the record for today's board meeting. And it is now so, as it has been read into the record. The city's solicitor, James Shea, has no abstentions this morning. The Director of Public Works, Jason Mitchell, has no abstentions this morning. And the mayor's designee this morning, CAO Chris Shorter, has no abstentions. Council President, that concludes my statements for this morning. Thank you.
Thank you, Madam Clerk. Just for a point of information, Madam Clerk, the walk-on items that total close to $5 million, when did the board receive those items?
They came to us officially yesterday, early morning.
Thank you. So just for the record, we've talked about this in the past explicitly, that walk-on items should be done in cases of emergency. That's for the fairness, that's for accountability, that's for transparency to the general public. The idea that we're walking on or attempting to walk on $5 million in items for what appears to be not time sensitive, meaning the appropriate process could be enacted, is unacceptable. This board took on a walk-on item last week of a non-solicited bid for an event that the city's putting on. And I was very clear at that time to the administration, my concern of doing it that way. I've been clear in the past about my concern of doing it that way. And at this time, the board can only assume that either this is a byproduct of operational dysfunction in the administration of not providing this board appropriate communication about items that they want to bring in front of us, or just sheer disrespect, particularly as it relates to the comptroller's office, who has to do the work to get it prepared for us, and my office, who would like to know and be provided information into these items, these really important items that we have to vote on. So we are not going to take a vote on the close to $5 million of walk-on items. We will ask the administration that, again, if it's not a case of emergency, that appropriate briefing is done, but more importantly, transparency is done and it's put on the formal agenda for us to move forward. Going forward, again, that's my expectation. That's a clear expectation. I think that we've been clear in the past. We've continued to work with the administration from day one on these types of walk-on items, but at this time, the board is not willing to accept this as a walk-on item. So we will move on to agenda. At this time, I'll call for a motion to approve and adopt the opening statement by the clerk.
So moved.
Second.
All those in favor of approving it's been moved and properly seconded. All those in favor, please say aye.
Aye.
All those opposed, please say nay. The ayes have it. The opening statement has now been adopted. I now would like to direct the board's attention to a memorandum from my office dated September the 19th, 2022, identifying matters to be considered as routine agenda items together with any corrections, additions, abstentions, and no votes that have been noted by the clerk. At this point, I'll entertain and approve a motion for us to accept the routine agenda items.
I move we approve the routine items.
And I second.
It's been moved and properly seconded. All those in favor, please say aye.
Aye.
All those opposed, please say nay. The ayes have it. The routine agenda is now adopted. The first set of items on the non-routine agenda can be found on pages 42, 43, 44, and 45, Department of Transportation. These items are requests to approve extra work orders number 14 and number 15 of Technopref Industries for the replacement of the Harford Road Bridge. Pages 44 and 45 reflect transfers of funds related to the extra work orders. Without objection, I ask that we discuss and consider these items as a group and pull them out individually, considering what our communication becomes from them. On behalf of Department of Transportation, we have individuals that's going to set us straight. So at this time, DOT, the floor is yours.
Hello, good morning, Honorable President and the Board. My name is Corinne Johnson. I am the Chief Engineer and Deputy Director for the Department of Transportation. With me today, I've got Bima Devkota, who's the Tech Chief, Scott Weaver, who is our Bridge Chief, and Brenda Simmons, who is our Contract Administration Chief. So we're available for any questions you all might have about these matters.
Just for general public knowledge, could you just kind of go over the need of the project and itemize out any major ticket items specific to the change order?
Sure. So as listed, item number 14 is specifically for rock elevation. So the rock was much more massive than anticipated, and so there had to be some extra compensation for the additional work centered around that. Item 15 was the water main work, so we worked with DPW on that. Some additional design changes necessary for the project. That's the extent of those two change orders specifically, and then there's the transfers that are associated with those. With this is a federally funded project, so there is the cost share, the 80-20% for the additional work. As far as the project in general, we have been working kind of in a moving basis of trying to determine when the project will officially be complete. I know that the community, the city, everyone is ready for this to be done. And so right now we have a soft opening working towards October 1. There are some material delays with the actual posts for on the bridge, and so we are coming up with an interim measure to put in some cones or something else to delineate the travel lanes from the bike lanes, and then once those materials are received, then the contractor will respond and put those in from a permanent standpoint. Aside from that, there's some other minor landscaping work, some work with the lights that are under the bridge along the trail, and other minor punch list items that the contractor will continue working on. So the community will still see some work, but the bridge itself would be open.
Factoring in this item, how much, based off the original estimate, have we overspent?
So the original bid itself was about $19 million. However, the engineer's estimate was $23 million. So based on the engineer's estimate, we're only 13% over, and that includes 2 additional anticipated change orders. We're still in negotiations for those costs, so I'm not going to speak specifically to them, but those are combined under $600,000.
And at this time, from all the knowledge that we have, the expectation of any additional change orders, where do we sit with that?
It's those 2 remaining, right? There's just those 2.
I guess I want to ask him a little more explicitly. Our expectation is there are no additional change orders associated with this?
Besides
these 2?
There's the 2 that are on the agenda today. There's 2 anticipated
There's
after
2
that.
additional. Okay.
And those are the ones that are in negotiations that are anticipated to be less than $600,000.
Okay. And are they factored into the 13% overage from the
Yes.
engineering spec? Got it. And then last question, the original expectation for completion versus where we are today, do you have that information?
What was the original completion?
Sorry, we're approximately 1 year past that date. We had a lot of rain, heavy thunderstorms, as most of the people in the city know, back in 2018, and that flooded the project site and caused significant delays to the project.
Understood. And again, the expectation for the soft opening is
October 1st.
October 1st, but
And
we're keeping our fingers crossed on that, right? That could change.
Well, God forbid things happen, but things do obviously happen
Yeah.
with construction, but that's what we're working towards, and we're working on the communications plan and what to expect for the community and motorists in the area. So
Okay. If you could just keep the board engaged on that, we'd truly appreciate that.
Definitely.
At this time, are there any additional questions or concerns? Mr. Comptroller, the floor is yours.
Thank you, Mr. President. Good morning.
Good morning.
Okay, so we're now up to 15 extra work orders. How many more extra work orders does DOT anticipate bringing to the board on this contract?
2. It would be like 16 and 17.
16 and 17. What was the difference between the, no, actually, you know what? Let me look at this differently. Yeah, okay. These 2 extra work orders are for little over $1 million to combined, 593 for 14 and 440, so a little over $1 million. what are you anticipating to be the total project cost for this at completion?
The total project let's see. It would be about, hold on a second.
That's including the 2 additional?
Yes.
Okay, so 25.3.
25.3 million. And what's the difference between that and the anticipated cost of the project when the contract was awarded?
So the low bid price was about 19 million.
Okay.
However, like I said, the engineer's estimate was actually 23 million. So looking at the 25.3 million, we're 2.3 million over the engineer's estimate.
Okay.
So.
I'm going to put a pin in that. I'm not sure we're going to come back to that today, but it does seem like maybe we should be having a conversation about when the low bid is that much lower than the engineer's estimate. It seems like that should be setting off some type of conversation internally about how that project's going to end up going. But like I said, we'll come back to that. How are we in terms of the original schedule? Where are we on time extensions? If you're going to be done on October 1st.
It was about a year.
It's a year? Okay,
So it was
that's
about a year
right. That's
past,
okay.
yes.
That was the part I was okay. And then I think that was it. Okay. In the briefing that you gave us last week, you said that this was Technopref's first city project. Can you talk a little bit to the board about what the history of working with this contractor has been like, and whether there were any notable issues with the contractor under this project?
Well, with any contractor doing business with a new entity, especially we have the city's processes, but then because it's a federal aid project, then there's a federal process, then there's a learning curve. And so that was evident, so things that maybe the other contractors that are more regularly working with us and working on the federal projects that just know the processes, there was a little bit more that we had to work through, let's say, of just making sure they understand the processes and follow those. So.
But you had said something about how they're a Canadian company, and so this was their first. Now, but it wasn't that this was their first project in America. It was just that
I don't know.
It was just this was their first project working with us here in Baltimore.
They've done other projects here in the United States. They would have to submit that from when they do their qualifications through the board. But they've done other projects in the United States, even like 1 or 2 other projects in Maryland, but there's still the learning curve between working for the city plus dealing with the state and the federal agencies as well.
Okay. And how did they do with their MBE and WBE participation?
The goal for the project was 18%. They're at 20%.
Oh, nice. Okay.
So they exceeded it.
Good. And then the final question I had, Mr. President, is does the contractor currently have any claims pending on the contract that could affect total project cost before we close out the contract?
So there are claims on the project, so we're still working through that process. I don't know how much more to speak on it from that standpoint.
Okay, I'm getting a very, very subtle but respectful sign from our council that we won't go into details on that at this time, but that is something that the board should be prepared for as we move forward to close out this contract. Okay, that's all the questions I have, Mr. President. Thank you.
Thank you. And I think our questioning were kind of aligned, meaning the questions I asked as well as the comptroller. If there's a way you guys could give us, well, I'm asking if you guys could give us, I guess, the original bid amounts. Really interested in looking at like the standard deviation, if this really fell far below it. Because I think to the comptroller's point, the point I was getting at, that it's important for us to pick the most responsible and responsive bid at times and not just the lowest bid. I know that this is something that this board has continued to try to push. Not saying that this falls into that regard, but really definitely interested because it's good to just kind of know the full story up front as opposed to kind of the lowest bid and then part of the story comes out a little later on. And I'm not saying that this is the case here, but just really interested in seeing that.
Understood.
Yeah.
At this point, Ms. Comptroller?
Well, I was just going to piggyback onto that the point you're making is probably one that should be a significant part of the conversation around procurement reform, and that hopefully we'll find that out, that is the case when the work group really gets going and starts sharing its results with the rest of us.
Thank you. At this time, are there any questions or concerns from other members? If not, I'll entertain a motion.
I move approval.
Second. It's moved and probably second. All those in favor, please say aye.
Aye.
Those opposed, please say nay. The ayes have it. This item is approved. Thank you so much for joining us today.
Thank you very much.
The next item on the non-routine agenda can be found on page 91, Baltimore City Police Department Agreement. The board is asked to approve an agreement with Mercy Medical Center. On behalf of the police department, we have Stephen Durkosh. Are you online? He's online. He's going to walk us through this agreement. If you're on, please unmute yourself and speak. Do we see him, Ms. Hubbard?
Good morning, Honorable President and Board.
Is anyone on from the Baltimore Police Department to speak on behalf of the Mercy Medical? He unmuted himself.
Yes. Can
Yes,
you
sir.
hear me?
The floor is yours.
Thank you, Honorable President and Board. I'm speaking on behalf of the Mercy Medical Memorandum of Understanding under our Sexual Assault Response Team and Human Trafficking in the amount of $53,436. The period of that agreement is from October 1st of 21 through September 30th of 22. The reason it's late is administrative delays. We put the application in on time. However, we did not receive the award until January, at which time we had to do revisions to the budget. Originally, they want us to reduce it by 30%, which took out a lot of line items from it that we had to restore. By the time we got back from our 6 subrecipients plus the BPD's budget, all the amendments and the funder approved, we had to then go back and redo all of the memorandum of understandings, which is why this is actually so late. Mercy is responsible for maintaining our human trafficking page on the Be More Safe app, which provides victim services resources on what they can do in the event that they're a victim of human trafficking or sexual assault. The second function for Mercy is to aid to facilitate in any testing that would be outside the norm of drugs or alcohol, specifically date rape, things of that nature, and to provide general services of forensic exams for any victims of sexual assault. We've been a partner with Mercy dated back to at least 2018 when the VOCA award was administered to both the police department as well as the Mayor's Office on Criminal Justice, now the Mayor's Office on Neighborhood Safety and Engagement. Come 2019, at the request of the funder, they consolidated everything into a block grant, at which time the police department became the sole administrator of all the VOCA funds. We adopted Monzi's budget, which included Monzi's 2 staffers, as well as a nonprofit Araminta and Turnaround, and the state's attorney's office. Originally, it was just the police department and Mercy, as well as BCAC, now the known as the Center for Hope. We do plan on continuing this program and recently submitted an application for those funds. In discussions with Director Shantae Jackson, we are going to be reaching back out to the funder to see if there's any chance they would separate the VOCA into 2 awards to allow Monzi to administer their original subgrantees and their budget, and to allow the police department to manage their original budgets, which would have included, again, BPD, Center for Hope, and Mercy Hospital. The police department does have a bulk of this budget. We have 11 people on it, as well as the 6 subrecipients. The fire department is the newest subrecipient for their human trafficking training program for EMTs. Again, that is why this is late, and that is the direction that we're moving in going forward.
Does that complete your presentation, Mr. Durkosh?
Sir.
I'm sorry, we couldn't hear you.
Yes, sir.
Oh, thank you so much. At this time, are there any questions or concerns from members of this board? I see the hand raised of Comptroller Henry. The floor is yours, Mr. Comptroller.
Yeah, Mr. President, I don't think I have as many questions as I originally had because Mr. Durkosh's presentation actually answered a number of my questions. I just want to make one of them very explicit because my question was, why is the police department applying for and administering a victim services grant? But you kind of laid that out, and it sounded like you said that you were pursuing having Monzi be the ones applying and administering this grant in the future. Is that correct?
Yes, we are going to speak to the funder and get their opinion on the best management of this. Again, the police department does have a bulk of the budget, so we're going to look at possibly transferring it to Monzi or going back to the origins of 2018 when it was divided into two separate VOCA awards that would allow BPD to control their own budget, as well as Monzi going back to controlling their budget with their sub-grantees, who are the nonprofits.
Okay. All right. Thank you very much.
Thank you, Mr. Comptroller. At this point, are there any additional questions or concerns from other members of the board? Hearing and seeing none, the board will entertain a motion.
Move approval.
Second.
It's been moved and probably seconded. All those in favor, please say aye.
Aye.
All those opposed, please say nay. The ayes have it. This item is approved. The next item on the non-routine agenda can be found on pages 96 and 97, Mayor's Office. This request is to approve and authorize the execution of a third amendment to a consultant agreement with Ernst & Young LLP to exercise the option to renew and extend the period of the agreement for an additional 6 months and increase the compensation by over $1 million. On behalf of the Mayor's Office, we have Deputy CAO Ariel Giles to discuss this item. Mr. Giles, the floor is yours.
Good morning, Honorable Council President and members of the Board of Estimates. My name is Ariel Giles. I am Assistant City Administrator for Performance and Technology Services. I'm here today on behalf of the Mayor's Office to discuss the Consultant Agreement Amendment item on the non-routine agenda. With this item, we're requesting that the Board authorize the execution of this third amendment to a consultant agreement between the City of Baltimore and Ernst & Young. This amendment will exercise the option to renew and extend the period of an agreement and increase the compensation amount by $1,010,000 as outlined in the board letter and supporting materials. The first amendment was approved by the board November 3rd, 2021 for the purpose of clarifying the funding source. The second amendment was exercising an option period and extended the term and increased the contract amount by $90,000. It also added some optional technology enhancements to the scope. The third amendment will allow the city to continue through the completion of phase 2 out of 3 of this multi-phase initiative. In this upcoming period, we'll develop and implement a technology solution called T-Hub or Transformation Hub. This will accelerate our ability to centrally coordinate project management oversight for the Mayor's action plan and enterprise-wide transformation initiatives. This software will also be central to the development of the forthcoming agency performance management system and enable us to integrate financial data, performance data, and project data from multiple initiatives into one system. For additional background for the public, this system is a part of the broader engagement around the implementation of the Transformation Management Office or TMO concept. The Transformation Management Office is a systematic approach to change management. This approach is central to our ongoing transformation efforts and assists with ensuring a continued focus on transparency, accountability, and predictability in the execution of strategic actions. A part of this work has been to support the development of the Mayor's Action Plan and the ongoing reporting and monitoring surrounding it. As you're aware, the Mayor's Action Plan is the strategic roadmap for action in this administration. The TMO structure has delineated clear responsibilities for actions among agencies and spurred interagency collaboration. It's also helped us to prioritize, resource, and report on actions. The team has supported our office in the hosting of frequent trainings, communications across agencies, and provided technical assistance to agency project managers. They've also supported and will continue to support the coordination of a set of enterprise-wide transformation initiatives. These initiatives are distinct from the action plan action items. They impact multiple agencies and they impact some of the core functions of our government. The purpose is to increase resource support, improve execution efficiency, and elevate the focus on outcomes. Some examples of these enterprise-wide transformation initiatives are procurement reform, permitting reform, agency performance management, and financial integration. So thank you for your consideration of this amendment, and I'm available to further discuss this contract if you have additional questions.
Thank you, Mr. Giles. What was the original award for this contract, and what dollar amount?
$660,000.
$660,000. And to date, if we include the $1 million increase, where does that put us at?
That will put us at a total contract value of $1,760,000.
All right, so more than double the original amount. Now, you talked about the 3 different phases. I think this helps us with phase 2. Is that what you said? Did I hear you correctly?
Yes.
So I guess the assumption is there will be additional need to extend for phase 3. Is that correct or no? Phase 3 is a separate bid.
Yes, there would be additional action needed, but the approach we took to this was to divide it up into these kind of 6-month increments, with starting with an initial contract term and then some options to extend. We did that intentionally so we could have the opportunity to evaluate the performance of the contract to make sure that we're getting the deliverables and the valuables the value that we wanted from the contract, and so that we would have the ability to extend it if we were meeting those goals and seeing that value.
When this contract originally came to the board, I expressed concern about I didn't think enough meat was there to deliver on the goals and the objections of what was kind of written, and it appears that to be the case, and without really any end in sight as relates to how much it'll ultimately cost for us to do. I am in favor of innovation, particularly as it relates to technology. Everyone knows I'm a recovering electrical engineer, so I do appreciate it and value it. The one thing that I just will continue to stress is we just have to be realistic at the beginning. I think that provides that level of predictability, what ultimately your tool is trying to help us come up with. It's just fair for accountability, for transparency to the general public. And I'm concerned that we started out at $600,000. Now we're over $1.7 million, and we do not necessarily know where the end in sight is. So I do have concerns there. This is something that was brought to us late on full transparency. We did get a briefing, my team, a couple working days ago, and as of late yesterday, we were provided the presentation. So I do have additional questions that we'll continue to kind of drill down on. At this time, are there any additional questions from the board? Ms. Comptroller, the floor is yours.
Thank you, Mr. President. Good morning.
Good morning.
Does the scope of EY's work include the development of any public-facing data sources or dashboards? And if so, what's the timeline for implementing them?
Thank you for that question, Mr. Comptroller. So the agency performance management system will help us develop a few things, and part of that will support certain elements that will be public-facing, and so we'll be able to continue what we've started around tracking internally a lot of the activities around these projects, but we'll also be able to extend that to some public-facing items. The agency performance plans that we plan to host in this system will be public, so those will be public piece of information, but then there are elements of this system that will be more for kind of internal management use.
So what's the timeline for producing them?
So the timeline for the production of the system, we plan to do 4 3-week sprints, and so that will take us to a 3-month production schedule for the actual agency performance management system. The plans, the agency performance plans are in early stages of planning, and so I don't have a time frame for you now when those plan elements will be public. We do currently have a action plan tracker that is public, and we're working to push updates through that for the action plan. But for the elements in this system of Transformation Hub that will be public, I don't have a time frame for when those will be published.
Okay, let me just make sure I'm repeating that back so I got that right. So the you're going to be doing the agency plans over the course of 4 3-week sprints. No?
No, the
Okay.
system will be developed.
The system will be
In a 3-month time frame, and then the actual agency performance planning process, we'll be launching that this year, and we'll be embarking on that. And as you can imagine, it includes all our agencies, and will be a pretty heavy lift. And so it will not be complete in that 3-month time frame. It's the system.
Okay, and so are the public-facing dashboards part of the system or something that gets developed after the system is in place?
So the public-facing elements will be developed in the system.
Okay, they will
And
be
then
built into the system.
Correct.
Gotcha, okay. Then you had mentioned that one of the reason you had broken the contract approvals into 6-month chunks was so that you can make sure that you're getting the deliverables and the value that you're looking for. What tangible solutions or deliverables has the city received so far from E&Y?
So would you like me to review the complete list of deliverables over the different contract terms?
As much or as little as you want to share.
Okay. This, I'll go over a few of the examples.
I mean, if you have a list that you want to just share with the board.
Yeah, I have a list, but the way that this engagement has worked is they've supported the capacity of our office to get our hands around the 183 actions in the mayor's action plan. And so that's included, everything from trainings for agency project managers to hosting, orientations, to doing surveys with agency leaders about why a previous change management efforts have failed. Getting that information, developing the governance structure that we have in place for managing the actions, deciding on what made sense for us to monitor those actions. So, for instance, on a monthly basis, we meet with our steering committee, which is made up of the deputy mayors, the city administrator, deputy city administrator, budget director, and our chief recovery officer, and we discuss actions in this action plan, and we use a systematic approach to do that status reporting. And so in those meetings, we have a need to develop those briefing materials, to work with agencies to get those updates in the system. We had to develop the system that we currently use, which is based in SharePoint and hosted in Teams. We had to develop that system, and so there's many elements of the kind of structure of how we're managing the completion of the items in the action plan that this contract has served us on.
Okay. Next question, and this is just, I'm raising this issue because this is an issue that I raised as a council person whenever the city looked to do work by bringing in an external contractor as opposed to doing it in-house. We have an Office of Transformation Management. We have an Office of Performance and Innovation. Why was the decision made to do this work by hiring an outside entity rather than have those offices provide it? And if the answer was those offices weren't up to it capacity-wise, why was when it was just one contract for $650,000, you can say, okay, this is a chunk of work and we're just going to do it and get it done. But if there's clearly multiple phases to it and there's going to be a much more extensive price tag, why would we not just staff up those internal offices and let them carry the ball for something like this?
So, as you know, Mr. Comptroller, there are capacity issues citywide. This part of the thinking was to be able to bring on this firm that has some expertise in management, and specifically to help us with this change management approach, and to put some of these structures in place. And so we do have a lot of talented individuals in our workforce. I work directly with our Office of Performance Innovation day to day, and they have been a part of this process. They've helped throughout. Our Chief Data Officer has helped develop the system we're currently using. Has helped throughout. They are central parts of this transformation management office concept, but we did need to bring more capacity. Throughout government, the only person that really had this kind of focus on this transformation management work today was me. We needed the staff support to keep our hands around this 180 actions across 30 different agencies. We needed to have the support to be able to manage those effectively.
So is EY providing you with technical assistance and staff support in the sense that they are providing more people to be able to address issues and help support you in that fashion? Or is it the expertise of a limited number of people? And I'm just trying to get this in terms of, is the issue that, and I say this as someone who I think is equally committed to innovating city government. I think we're all with you on the idea that we could be working better. What I'm trying to get a sense of is the Office of Performance and Innovation insufficiently staffed in terms of number of people such that they weren't in a position to provide the staff support you need for an innovation measure like this?
So this is not this is not completely in the kind of purview of what the work is that the Office of Performance and Innovation does. Certainly that's part of it, but it's broader than that. And so I think I don't want to speak to their staffing levels right now, but I think they've done a great job. They have the capability to do a lot of the work, and they've continued to work hand in hand with this team. The way that this has worked is agencies are responsible for the execution of the actions. We've developed a structure for accountability and for kind of systematizing and providing kind of rigorous project management at the executive level for supporting those agencies. But the members of the team on this contract have helped citywide. They've helped action owners, which are the project managers at the agency level, to develop their work plans, to think about how they're doing their work in a different way. And so each of the 183 actions in this action plan have work plans associated with them. And so they've helped support those action owners in many different ways. They also have furnished some subject matter expertise. That's what we do get from having a global firm like this to work on an initiative with us like this. Is they do have that expertise. They do have some contacts that we have brought to bear to get additional information on approaches. So it's not that our staff has not, our city staff is not capable. We just needed additional capacity, and that's how we chose to do that.
I think the last question I'm going to ask here is, in our initial briefing about this item, we discussed allowing you time to prepare a presentation for today, and what we were thinking that was going to involve, and this is where, like, with the list of deliverables, we're expecting something more like a PowerPoint presentation or a handout, something that we can share with the public to explain what we just did, because we're going to be potentially, I think the president said that, no, you added up that it would be $1.76 million after today's action. And that just, I think we're definitely now getting into the range of funding where we want to be able to show people why we're doing this. Why was the decision made to just have you give a verbal description of the project instead of something more comprehensive?
Yeah, as I understand, we did brief you on this, and as I understood, it's not typical for presentations to occur at the non-routine agenda item. We haven't seen any today, and so I chose to give a statement accordingly, as most non-routine items.
Okay. All right. Thank you, Mr. President.
No, thank you. Mr. Comptroller, just so I can understand, do you feel like, I guess, your briefings to date and the administration's ability to keep you up to date on this particular project, are you satisfied with it?
Well, one of the things that I'm concerned about is I think we gotta, I don't think this is a complaint, but it might be a constructive criticism, is we did get a more extensive briefing individually, and I was hoping that that could be shared. And I thought that part of the time between when we got our briefing and this meeting was going to be time to take that presentation and sort of recraft it so that it would be good for public consumption. And so I'm a little surprised that we're not there, and I kind of wish we were. I'm still on the fence about the issue of whether we should be continuing to pay EY what appears to be a very high hourly rate in terms of for providing you the staff support you need to get this work done, and whether there's a potentially more cost-efficient balance of what we're paying them for their expertise and where we staff up in-house to provide you with proper staff support. But I don't know that that option is really on the table. I'd know that that's just a concern of mine from the level to which I do understand this project.
Thank you, Mr. Comptroller. Mr. Giles, your presentation and your communication in the past has always been very professional and responsive to whatever limited questions that we knew to ask. So let the frustration or disappointment or concern moving forward from this board be not directed to you and what you've been able to provide us to date. Just probably more about the process and more about this consistent theme of concern that myself and I believe the comptroller shares. So just wanted to say that to you specifically. I think on that point, it's no point of belaboring it. Are there any additional questions or concerns from members of the board? If not, I'm going to ask that we defer this item. I do have some additional questions that we want to kind of address. So the process is we'll just have to bring it back at a later date for us to talk.
Okay.
Is there any level of urgency or?
I
saw your face.
Yeah, the contract, the previous contract did end, and so there's just more work that we want to get done, and so it's every week or month or 2 weeks we go without it.
It's a concern.
Is kind of delaying some of the work we want to achieve.
Understood, and I appreciate that. I think this kind of goes back to, again, a consistent theme of us allowing contracts to lapse and then bring it back into the board, and then it puts us in a really awkward situation to kind of hurry up and approve things without maybe appropriate context. You have something to say?
I'm sorry, when you say the previous contract lapsed, so are we out of contract right now?
No, well, they have not done any work since the end of the contract period.
And when did the contract period end?
In August, I don't have the exact date right here. I think it's August, second week in August.
Maybe the beginning of August.
Okay, all right.
Yeah. So I'll make sure that my office and my staff that we'll work expeditiously to kind of better understand and get all our questions
August
to you.
15th.
August 15th. Yeah, all our questions and concerns to you. I know the comptroller is committed to doing the same, but at this time we're going to defer this item unless there's any objections or concerns from members of the board. Seeing none, the item is deferred. Thank you so much, Mr. Giles, for coming before us today. Moving on to our next item on the non-routine agenda can be found on page 137 and 138, number 12, Bureau of Procurement, contract B50003266, police uniforms, where multiple vendors are involved. On behalf of BPD, we have Ms. Shala Graham to speak on the contract. Ms. Graham, the floor is yours. You have to unmute yourself, Ms. Graham.
We have to unmute her. Hey, oh, yeah.
There we go. No.
Yeah.
No, we still can't hear you, Ms. Graham. Try to unmute yourself again.
Oh, she said she.
Good morning.
There we go.
There we go.
Perfect.
Hello?
Yeah, loud and clear.
Okay, thanks so much. Well, good morning, Honorable President. Sorry about the audio issues. I was asked to come here today to talk about upcoming changes with future agreements as it relates to uniforms. So the Baltimore Police Department has done a lot of research on the quartermaster and outsourcing the quartermaster. And it's seen as the best practice with other agencies across the country. So next time we come forward to you, we will be coming forward with a contract. We're still working with the Bureau of Procurement to discuss potentially outsourcing the quartermaster. And the benefits to the police department and the city is there's no requirement for inventory. So not only does that reduce the money that's tied up in inventory, it also reduces the need for a large real estate footprint. And then it also reduces the need for staff that are assigned to the quartermaster itself, and those staff can be assigned back if they're sworn to sworn operations. And also at the same time, the PC has been working on new uniforms. We established a new uniform committee. So we will have new uniforms that will be going forward. So this is a great time to look at the way we deliver our uniforms to our personnel and make sure that we're using best practices. With that said, I'd love to answer any questions that you may have of me today.
At this time, I'll turn the mic over to Ms. Comptroller. The floor is yours.
Thank you, Mr. President. Good morning. Do you, at this point, can BPD give the board a rough idea of the potential cost savings when you move from the warehouse model to this new approach?
Yes. Good morning, sir. I can't give you an exact number right now. There assumes to be cost savings because of the economies of scale and how this works. So the vendors do this for other large agencies. So they get the better economies of scale on the uniform, which allows all the other stuff to come for free. The reason why we don't have an exact quote right now, obviously we're still working with the Bureau of Procurement and have to get that in, but we're waiting for the PC to approve the new uniforms. So once we have those new uniforms, we'll be able to get the actual quote, which will provide any cost savings. Right now, I can tell you we've spent probably, it goes up and down, but last year we spent just over $800K on uniforms.
Wow. Okay. All right. Thank you very much.
Ms. Graham, do you know the women or minority-owned business enterprise involvement in this moving forward?
As I mentioned, we're still working with the process to get through, go through procurement. But, somebody suggested the other day that obviously this is all online ordering, online delivery. But one of the items that BPD would like to put forward in our scope of needs is to have a tailor, an on-site tailor, so that, obviously if the pants are too long, they can be shortened and adjusted for our officers. So that would probably be the area where we would focus on to meet that goal.
Thank you. And it's just for the general public's edification. This, when we vote today, if we approve this, specifically, what this will allow BPD to do moving forward?
Yeah, and actually the current contract that you're approving today is for the status quo. It's for the same way we do it today, which is having a quartermaster, and we manage everything, we do everything, and we just get the uniforms from a vendor. So that's what you're approving today, is the extension of that contract. But I think it was a good opportunity for us to tell us that this is probably the last time you'll approve it in this fashion, because the way that we are going to procure this going forward is going to be more of a full outsourcing approach.
Understood. I just wanted to provide clarity to the general public on that. At this time, are there any additional questions or concerns from members of the board? Hearing and seeing none, I'll entertain a motion.
I move approval.
Second.
It's been moved and properly seconded. All those in favor, please say aye.
Aye.
All those opposed, please say nay. The ayes have it. This item is approved. The next item on the non-routine agenda can be found on page 144, Bureau of Procurement. This request is to approve an award of solicitation number B50006455, Medicare Advantage Plan with prescription drug benefits to Aetna Life Insurance Company. To walk us through this award, we have the head of the Department of Human Resources, Director Quentin Herbert. Director Herbert, the floor is yours.
Thank you. Good morning, Council President, Comptroller Henry, CAO Shorter, and other distinguished members of the board. The RFP for the Medicare Advantage Prescription Drug Program was a proposal for a 3-year period beginning January 1st, 2023, with 3 additional 1-year term extensions at the sole discretion of the city. The city has approximately 14,000 Medicare eligible participants enrolled currently in an Aetna MAPD. Proposals were opened on April 6, 2022, shared with our Siegel team, and as well as we had a RFP, a review committee that was comprised of city and labor stakeholders, as well as the city's actuarial expert and labor's actuarial expert as well. We received 2 proposals, one from the incumbent Aetna, one from Care First. Aetna's rates were 7.1% lower than current and 24% lower than Care First over a 3-year period. Aetna also offered an enhanced benefit to the city for transportation services to Medicare eligible retirees at no additional cost. And as the incumbent, there will be limited, if any, disruption to our retirees if Aetna is awarded the contract. Aetna was determined by the review committee to be the best fit for the MAPD plan by the review committee, and that is why Aetna is being forwarded to the board today.
Thank you, Director Herbert. Does that complete your presentation?
For the MAPD plan, for the item on page 144, yes.
Thank you so much. At this point, are there any questions or concerns from members of the board? Ms. Comptroller, the floor is yours.
Would there be some value to him just doing all 3 and then taking questions on all of them?
No, we can vote if you guys are ready.
No, I'm saying, could he do his presentation for all 3, and then we could ask questions about all 3 before we?
Do you have questions?
I have questions about all of them.
All right. Well, I think the presentations are somewhat consistent. We're going to keep the vote separate.
Okay.
But at this point, I'll give you the floor. I think he's probably prepared to speak on it. So, Director Herbert, the Comptroller has asked that he has some questions that will be germane to all 3 different items. He's going to ask them now. Obviously, if there's additional information that you haven't communicated specific to one of the others about this Aetna deal, please do so. And then at that time, we'll field any other questions and then vote individually. But they'll be read in individually by themselves. So at this point, Mr. Comptroller, the floor is yours.
Thank you, Mr. President. Good morning. Mr. Herbert, is there a sum total of the difference in cost to the city for the new contracts versus the previous contracts?
The total cost, I don't really understand your question. If you're talking the total cost.
So here's what I mean. Like if you look at these awards, where the award for the Medicare Advantage plan to Aetna is rounding up $139 million. Pharmacy benefits to Caremark PCS, $128 million. Medical administration services to Aetna and Kaiser, roughly $530 million. How does that compare to the previous contracts? How much more is the city spending? How much less is the city spending?
I would have to look at that and compare them side by side. Okay. Keep in mind, these are for the administrative costs. Right. The city is self-funded, so when we're talking about claims, the city is self-funded. We pay those.
This question is just about the administrative costs.
Right. I would have to get back to you because I don't have those prior contract numbers in front of me.
Okay. If you could forward that information, that would be great. And then while I understand it's simpler to use percentages when you're comparing the cost increases for the new contracts versus the old ones, when you're talking about how much the city employees are paying and retirees, they need to understand how much it's going to cost them. So is there a median amount a plan beneficiary paid for health benefits in calendar 2021 and 2022 compared to what you're projecting for 2023?
Yeah, a median amount wouldn't really get you anywhere because in addition to having 4 plans, we have a tiered system. So I can provide you is what the actual cost for those in each of the tiered systems is. Also, the actual dollar amount is provided annually in the benefit books for our active employees and our retirees. I can tell you, for example, for the most populated of the programs, which is the Blue Cross High Option Medical Plan, the participant only cost in 2021 was $80.82 per pay. In 2022, it was $83.73 per pay. And for 2023, the proposed is $91.44, which is an increase of $7.71 per pay, or 9.2%. At the other end of the spectrum, for those who have the family option, in 2021, that cost was $242.46 per pay. In 2022, it was $251.19 per pay. For 2023, it will be $274.31 per pay, or an increase of $23.12, or again, 9.2%. And it's worth noting that 9.2% also reflects the city subsidizing some of the increase, because the increase really was 12%, but the city has subsidized some of that so that it's not as much sticker shock to our active employees. The standard option medical plan under Blue Cross Blue Shield, the participant only for 2021 was $56.91. For 2022, it was $58.96. And for 2023, it will be $64.39, an increase of $5.43 per pay, or a 9.2% increase. Again, the opposite end of the spectrum, the participant and family, the 2021 rate was $170.73. For 2022, it was $176.88. And for 2023, the rate will be $193.16, an increase of $16.28, or 9.2%. For the HMO plan, which is an Aetna plan, for the participant only in 2021, that cost was $23.69. In 2022, it was $24.55. For 2023, the cost will be $26.81, an increase per pay of $2.26, or 9.2%. Again, for the participant and family, which is the high end of that plan, the participant only cost for 2021 was $71.09. For 2022, it was $73.65. For 2023, that cost will be $80.43, an increase per pay of $6.78, or 9.2%. For a Kaiser plan, for participant only in 2021, that cost was $26.52. For 2022, it was $29.09. And for 2023, it will be $31.62, or an increase of $2.53 per pay for the individual only coverage. For the participant and family, for Kaiser, for 2021, that cost was $79.56. For 2022, that cost was $87.28. For 2023, that cost will be $94.84, a per pay increase of $7.56. And then for the prescription drug, again, we have two, the high option and then the standard option. For the high option, CVS, the 2021 rate for employees was $8.54. For 2022, that cost for participant only was $8.85. For 2023, that cost will be $9.67, an increase of 82 cents, or 9.3%. For the participant and family, under the high option plan, that cost is $25.62 per pay in 2021. In 2022, that cost was $26.54. For 2023, that cost will be $28.99, an increase of $2.45 per pay, or 9.2%. And then finally, the standard option, CVS standard option, for 2021, the participant only was $7.07. The employee cost in 2022 for participant only was $7.32. And the cost in 2023 will be $8 even, an increase of 68%, or again, that 9% increase. And for participant and family, the employee cost for 2021 was $21.20. For 2022, it was $21.97. For 2023, it was $24. It will be $24, an increase of $2.03, or again, that 9% increase. And that's for the actives with the bi-weekly deductions.
So, Mr. Herbert, first of all, I want to congratulate you. Usually when people tell me that the question I've asked isn't one that would get an answer that is going to be helpful, they just leave it at that. But then you actually went and gave the answer we actually needed. So thank you. I appreciate that greatly. I also want to extend to you the same invitation I extended to the council president at a previous meeting. If you want to come down here at noon for when we're reading bids, I could see that the clerk was like, we may have a natural right here. The last question I would have, and this won't require you to read any additional numbers, have any of the city unions or bargaining units expressed concern with or opposition to the new health benefit plans? I know that was an issue last time. Is that an issue this year?
It is not. In fact, we had labor stakeholders, again, on the evaluation committee, as we have in the past. The rates were presented to our labor stakeholders in our health insurance committee. Our experts worked together in tandem. There was consensus and agreement over the rates, which is why I believe that there have been no protests or anything received, because we had consensus at our last HIC meeting with respect to the rates.
Okay, thank you very much. Thank you, Mr. President.
Thank you, Mr. Comptroller. At this time, are there any additional questions or concerns from members of this board? Hearing and seeing none, we're going to vote on this item. I will take a motion.
Are we considering all three or just the one?
I'll just do the one because I only read the one.
Okay, I move approval of the Medicare Advantage plan.
Second. It's been moved and probably second. All those in favor, please say aye.
Aye.
All those opposed, please say nay. The ayes have it. This item is approved. The next item on non-routine agenda can be found on pages 145, Bureau of Procurement. This request to approve the award of solicitation number B50006476, Pharmacy Benefits Management to Caremark PCS Health. Director Herbert has already presented on this item. Are there any additional points that you would like to clarify, Director Herbert?
No, if I could, Mr. President, I would also just like to note for the record that with our MAPD, I know we approved it, the Medicare Advantage Plan recipients actually saw a 7% reduction in their premium. So they're actually going to pay less in 2023 than they did in 2022. And I highlight that because our retirees are among our most vulnerable population. And I think that that is a great achievement, that their costs are going down.
Thank you so much, Director Herbert. At this point, are there any additional questions or concerns for the item that's on the agenda? Hearing and seeing none at this time, I'll entertain a motion.
I move approval of the pharmacy benefits management proposal.
Second. It's been approved and probably it's been moved and probably second. All those in favor, please say aye.
Aye.
All those opposed, please say nay. The ayes have it. This item is approved. The next and last item on our routine agenda can be found on pages 146 and 147, Bureau of Procurement. This request is to approve an award of solicitation number B50006336, Medical Administration Services for HMO and PPO plans. At this point, Director Herbert, is there anything to add on this particular item?
No, sir.
Thank you so much, Director Herbert. From the board, are there any questions or concerns? Hearing and seeing none, I'll entertain a motion.
I move approval of the medical administrative services for HMO, PPO plans.
Second. It's been moved and probably seconded. All those in favor, please say aye.
Aye.
And all those opposed, please.
Sorry, I was trying to say aye.
Oh. All those opposed, please say nay. The ayes have it. That item is approved. That's it for business before the desk. At this point, I'll turn it over to the Comptroller. I believe he has some closing remarks.
Thank you, Mr. President. I did want to just close by calling the board's attention to an issue that I've focused on throughout the summer, which is retroactive grant agreements. On our routine agenda today, pages 60 through 82 cover 22 grant agreements for the Health Department. Of those 22 agreements, 11 were submitted after their expiration date, and 3 have an expiration date of September 30th, 9 days from now. So just over 60% of these were retroactive, and that's just on this agenda. I wanted to just call the board's attention to that. I appreciate that representatives from the Health Department came to the board 2 weeks ago to talk about the progress that their agency has made on its work plan. My office has shared that work plan with the rest of the board, and I look forward to the agency coming back to the board on November 16th to give an update on their progress. Thank you.
Thank you, Mr. Comptroller. Is there anything else for any other members of the board to add before we adjourn? Hearing and seeing none, again, there's no new business before the desk. We'll adjourn until bid opening at noon. The next regularly scheduled meeting of the Board of Estimates will occur on Wednesday, October the 5th at 9 a.m. I'd like to thank everyone for tuning in as well as coming and joining us today. Baltimore, please continue to stay safe. We absolutely love you.
Good afternoon, everyone, and welcome to the Baltimore City bid opening for September 21st, 2022. I am joined today by my lovely and talented colleagues, Jalen Sanders, James Knighton, and Sherelle Holly. Thanks to my team for being here today and helping do our diligent and detailed bid opening process. This morning, I first need to share a few addenda that we have received. First item is from Procurement, contract number B506559, supply and delivery of uniforms. This was originally due today, 9/21/2022, and the new opening date is now 10/19/2022. Again, that was 10/19/2022. Also up from Procurement, contract B506614, police requested towing services. This bid opening has been changed from 9/21 to 10/19/2022. Again, that was 10/19/2022. And final addenda received from Public Works, contract number SC992R, egg-shaped digester rehabilitation improvements at the Back River Wastewater Treatment Plant. The due date was 9/21, and that new bid opening date is 10/5/2022. Again, the new opening date is 10/5/2022. And today we have two openings. The first up is a solicitation for the Bureau of Procurement, contract number B5000-6565. Hand power tools and related equipment.
Okay, the first submission is from Baltimore Home Center Incorporated, TA Suburban Ace Hardware.
And the bid amount?
Yeah, reviewing the bid amount, certain items were listed as no bid. Certain items were, they appear to be referring to other price lists somewhere, but there are no actual bid numbers in the bid.
Okay. It sounds like we will need to refer that one to law for review.
Yes.
Thank you.
Oh. Next bid, Jim?
Oh, okay, that's, all right. Okay, next submission is from Snap-on Industrial. Okay, and we have a letter from them okay, they're declining to submit a bid response.
Okay.
Thank you. Better
Okay,
receive.
that was Snap-on Industrial, and they have declined to submit a bid response at this time. Next up.
The next submission is Applied Industrial Technologies Incorporated. Applied Industrial Technologies Incorporated. There are no prices listed in their bid. They have reference to certain percentage discounts, but no actual prices.
Okay, I think we will also refer this one to the Law Department to review before it goes to the agency.
Yes.
And next up.
Next submission is from the Baltimore Auto Supply Company. Again, they have no bid on numerous items. Other items have dates filled in and percentage discounts, but no actual prices.
Okay, I'm going to run through all of these bidders so it's really clear for folks that are listening in. But Baltimore Auto Supply has also sent a bid that we are going to refer to the Law Department so that they can review the bid requirements against what was actually submitted by each of the companies. But right now we have a bid from Baltimore Auto Supply Company that will be referred to Law. We received a decline to bid by Snap-on Industrial. Again, they did not submit a bid, they declined in writing. Baltimore Home Center Incorporated, trading as Suburban Ace Hardware. This bid will also, again, be referred to Law to compare the requirements of the bid against what was actually received. And finally, Applied Industrial Technologies, item also being referred to Law for a comparison to the bid requirements. So we will not be listing any prices when we post this information today, but simply the action that we're taking.
Yes.
And that was the final of the four documents received.
Last of the four.
5000-6565.
Yes.
Okay.
Confirm.
Cool. Thank you. Our next bid today is from the Department of Procurement, or Bureau rather, contract number B5000-6652, Community Planning Survey Services, and this is a price proposal opening.
Yes, we have one submission. It is from the Melior Group, M-E-L-I-O-R Group, and their total price is $158,200.
Okay, that was the Melior Group, and the bid amount was 158,200.00.
Yes.
Galen will triple check me. $158,200.
Yes, $158,200 confirmed.
Is there a copy with that?
There. No, I do not believe
Okay,
there's
we
a
have an
copy of
original
that.
and, so we just have an original for that one? We may have an
Unless it's
original.
on the, there are
Oh, okay.
copies of it.
We have an original and multiple copies, and we'll confirm the number of copies
Okay.
when we go through. Okay. Again, that bid was from the Melior Group for $158,200. That was the only bidder.
Yes.
For contract B 506652, Community Planning Survey Services.
Yes, and we have an original plus 7
Oh,
copies.
thanks. Original plus 7 copies.
Okay, thank you.
And I believe that concludes our bid opening for today. So thanks, everyone, for tuning in. Thanks to our live audience. We appreciate your time and attention, and we will see you on next bid opening is October 5th. Thanks, team.